I was so excited when my patient sent me these lovely photos of her first day of chemotherapy. She looks amazing. I feel like attitude is everything. So I really want to just encourage women that are out there to just be more mindful of, your attitude does determine your altitude and how far you go and how well you do. And although the first treatment, she came in today and I could not barely tell that she had had any sort of treatment done. So how are you feeling?
I'm feeling great. I feel amazing.
Yeah.
Full of energy. And it doesn't even feel like, I had a treatment this morning in comparison to all the horror stories that I've heard related to chemo.
Yeah. And that's the thing that has always concerned me, is that a lot of times people will rather die than have to face the fear of the possibility of side effects that they've heard about, because not everyone is going to have every side effect. Not everyone is going to have just this terrible outcome. It is difficult, but it's definitely doable. And so I definitely want to use her as an example to just show you that although it's a big road ahead, a journey of 1,000 miles starts with the first step. And I've had patients that will choose to lose their hair, will lose their life, instead of losing their hair, and you chose to shave your head. And why did you make that choice?
I did. I didn't think that mentally and emotionally I would be able to deal with it coming out, like waking up and it was on the pillow.
Yeah.
So I decided to be a little proactive and shave it off. And actually, it feels good. This is wonderful. I love
it's easy.
It's
easy. Yeah.
It is.
And again, you lose your hair, it grows back, but you gain your life. And so, just so women can understand that these changes, although they can be drastic, is temporary. Because the main thing is just to take the first step, know that you can treat it, beat it, move on, and that's what we're going to do. Yes. And you started that today.
I started it today, yes.
Oh, I'm excited. Can I give you a COVID hug? I'll point my face this way.
Yes. Thank you.
You're going to do absolutely. Thank you for sharing that, for sure. Patients will oftentimes choose to do alternative medicine versus your traditional systemic chemotherapy for the fear of the side effects. And that could be anything from vitamin infusion to edible or oral herbs. And you were sharing with me that you at first wanted to do complementary or alternative treatment as well. And what made you change your mind, or what type of alternative treatment were you considering?
I took a lot of homeopathic remedies initially, which did help to minimize the growth of the cancer. However, I knew that it wasn't going to be the be-all. After talking with my sisters, I shared with them that I would rather just, take the cancer with me and allow it to take its course, whether or not it was a week, a year, 10 years, or what have you. And they convinced me to do traditional treatment.
Yeah, and I have to say, I think that approach was very brave of you. I'm glad you listened to your sisters. A lot of part is we fear we don't understand. So it's important that we, as clinicians, try to educate people so they're not as fearful, so they'll know that, yes, there are certain various treatments have side effects, but a lot of treatment is catered to the individual, where we have less toxicity, we minimize the toxicity, maximize the efficacy, and if you have side effects that are debilitating, we now stop and then start back later. Whereas before, we usually will have a continuous treatment regardless of how well you did. And I cannot tell you how many patients come to my office at least once a month that tried the alternative approach, because that means you're just doing the vitamins and herbs by themselves versus a complementary approach where you continue with the vitamins, the herbs, which I strongly feel that, it definitely helps patients feel better, but it's not the end-all be-all, like you said. You've got to complement that with your surgery, your chemo, your radiation, etc., if that's part of your treatment plan, complementary. And but anyway, every month I have patients, they come, they try the alternative medicine. I say, that is something that's a personal choice, but if you decide to pivot and do traditional medicine, give me a call, and by the time they come back, it usually has progressed so much that I cannot even operate. It's no surgical option. They're asking for chemotherapy, and chemo is not an option because at that point it's not curative. They're asking for radiation. Again, it's not curative at that point. You're just palliating it. So I'm just glad you used this opportunity, this window, to be courageous enough to listen to your sisters and to listen to your gut, but also not abandon what you feel is core which is to try to do things that has minimal toxicity, but you say, hey, this is not the end all be all, so let me be courageous enough to pivot and see how this other treatment or traditional treatment will go.
Correct. One of the things that I've learned throughout this journey is the importance of the doctor's bedside manner. When I came to you, you explained it to me like I was a third grader. You didn't speak in clinical terms. You spoke in plain English. I was able to understand exactly, what you were saying, and I understood the process. Sure. And I think a lot of times we are fearful to advocate for ourselves because of how we're being spoken to by the clinician.
Yeah.
And I found that that's everything.
It is. I've had patients where they have a delay in their treatment. They were diagnosed, let's say, 6 months ago or a year ago, and they come to me for their treatment, and my question, in a very compassionate way, I just asked, what contributed to the delay? Was it scheduling? Was it logistics? Was it finance? Just so I can have a better understanding. And many of them will say it was because that first initial visit of whomever they went to was so off-putting, and the bedside manner was unacceptably, just egregious, that they didn't want to go back. And instead of not going back, they didn't want to go anywhere or do anything. They said, I could just might as well do this myself if every time I have to show up for my appointment, if this is what I'm going to have to deal with. So I really want to implore my colleagues, I know we're all overworked and stretched to the hilt, but to try to insert that compassion and competency and customer service, which is our 3 C's here, and encourage patients that if you're not getting the compassion, the competency, and the customer service you feel that you deserve, then you should definitely get a second or third or fourth opinion. You just have to do it till you get it right, until it's a good fit. And so I'm glad we were able to accommodate that, and that your other doctor's visits have been going okay as well in terms of bedside.
Oh, absolutely. I have the best. I mean, my team, doctors have been phenomenal. You guys have been great.
Yeah.
And thank you.
Yeah. I don't always get it right, but I try to choose doctors I feel like it'll be a good fit for each individual. So I'm glad that the team we chose for you was a good fit.
Definitely. Yeah. And the open dialogue is real important, because I'm not afraid to ask questions. I have a better understanding. You guys planted a lot of seeds, so at least I can go back and do my own homework and come to a better understanding. Yeah. But initially I did not receive that, which is why I was fearful of even going through with the process.
Yeah. But I'm proud of you. You did it.
I did. I overcame the fear. Thank you so much. You guys, you've been great.
That's right. Treat it, beat it, move on. Like one conversation at a time, one treatment at a time.
That's it.
All right.